will now turn to my Florida friend and colleague, my dear friend and colleague, the ranking member of the subcommittee, Ranking Member Frankel. You're recognized.
Thanks so much, and thank you to both our witnesses for being here. I'm sorry you've been shocked. You were shocked. Just let me tell you. All right.
I know that. I know that.
He knows.
Yes, I do.
Listen, this is going to be, this may be one meeting we're going to almost agree. Almost.
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 For us, that's pretty good.
Yes. But listen, just again, thank you for joining us today to discuss the future of PEPFAR, one of the most effective and most bipartisan global health achievements in American history. And I'll repeat a little bit only because we all get, I guess we all have to hear ourselves talking. What can I say? Since its launch under President George Bush, I'm going to give him credit. In 2003, PEPFAR has saved more than 26 million lives, supported HIV testing for over 71 million people, prevented 5.5 million babies from being born with HIV, and provided care to 7 million orphans and vulnerable children. It's trained over 330,000 healthcare workers and built a health systems that serve more than 50 countries across Asia, developing countries, across Africa, developing countries in Asia, Latin America, and the Caribbean. And I want to say something. I don't know if you remember this. We served in the state legislature together. But my first assignment, maybe you weren't there yet, my first assignment, I was made the chair of an HIV/AIDS task force. And that was in the late 80s, early 90s. And I just remember, because I spent so much time, it was a, and it still is obviously, a horrible disease where people wasted away, most got infections, lung infections, and it was a death sentence. Without any question, it was a death sentence. Until, many years later, finally we do have a way with a cure, or not a cure, but to put it in remission, and people can actually live normal lives. But it's not just about the numbers. This is about communities that went from despair to survival, and then opportunity. It's a kind of soft power that makes the world safer and makes America stronger and more prosperous. Before PEPFAR, HIV/AIDS was wiping out entire generations across African countries and developing countries, and it decimated economies. It shattered families, created instability that threatened global security. But PEPFAR turned the tide. It showed the world what America can do when we lead with compassion, science, and smart investment. And to my chair, I agree with you of this. Every administration has a right and a duty to evaluate government programs. But what we've seen from the Trump administration, and this makes me very sad, especially with this program, is a reckless, dangerous sledgehammer approach that puts lives at risk and throws global partnerships into chaos. That's our diversion today. And from what we have heard, many PEPFAR programs have halted midstream. Waivers may be well-intended, but they're not working. We've heard that. Staff has been left unpaid. We heard that. Medicines are not reaching those who need it. And health systems that rely on consistent support are now scrambling in confusion. And I'm going to just briefly touch on this criticism that we're hearing that PEPFAR in 2024, an audit, and I'm glad there was an audit. It was an audit. It found that nurses in Mozambique had subcontracted through local partners, had performed 21 abortions over 3 years. That's what the audit showed. And even though abortion is legal in Mozambique, the U.S. law, we know, prohibits the use of foreign aid for abortion services. What was found was that the issue occurred because the nurses had not been trained on the restrictions under the Helms Amendment. But once it was identified, CDC immediately halted the funding and conducted a full review. It was $4,000. They collected $4,000 in salaries from the Mozambique government. It was an isolated incident and promptly addressed through improved training and accountability. And I have to emphasize, this represents a tiny, tiny fraction of the PEPFAR's $6.5 billion annual budget. And listen, nobody is perfect. Nobody. all right? I think they admitted the mistake, they repaid, let's move forward. But PEPFAR is not just a public health story. It builds resilient societies, keeps children in schools, it strengthens local economies. It reduces the risk of extremist recruitment because people are in a stable situation. It builds trust in America. Boy, do we need that. And I'll say it again, it makes our country stronger, safer, more prosperous. And what we do through PEPFAR has a direct impact on the health and safety of American people. The stronger the health systems are in other countries, the better we are all prepared to detect, detain, and respond to outbreaks. We're in this together. So now we're at a crossroads, and I hope this is where I think we are going to work very, very hard to find consensus, because if we allow PEPFAR to be splintered, this cost will not just be measured in dollars, it'll be measured in lives lost, health systems weaken, trading partners diminish, society is destabilized, and trust in the United States eroded in the world. So today, I'm going to join you. I'm going to join you today as we move forward with bipartisan cooperation, which what got this program started in the first place, to ensure that this life-saving, globally respected program not only survives but continues to thrive. And as we move forward, we look for ways to strengthen PEPFAR's operations, make it more efficient, more sustainable, so it could, hopefully we're going to find a way to just stop this AIDS, well, it's not a pandemic anymore, but the AIDS disease, but also leave in place some sustainable health systems. So let's work on this together. That's where we agree, and I yield back.